name's Jessa. I'm going to be the nurse today, and we're going to do sterile suctioning. I'm going to start by doing hand hygiene. I'll put my patient in semi-Fowler's position. I'll put my gown, my mask, goggles if needed, and I'm going to put my gloves on. I also could place the towel over top of my patient. I'm going to then check my wall suctioning. I would make sure that the line's not occluded. When suctioning for an adult, it would be between 100 and 150 millimeters of mercury. For a child, it would be 100 to 120 millimeters of mercury. And for an infant, it would be between 50 and 95 millimeters of mercury. I then will remove my gloves and dispose of those. I'm going to open my sterile kit here and remove my sterile box. I'm going to make sure to keep the inside sterile, putting it together. I'm going to grab my sterile saline here, removing the cap, keeping the top of it face down. I would pour out the excess on top, making sure, because the rim could be contaminated still. I then will pour the excess into my sterile cup here, place the lid back on. I then am going to take my sterile kit out, dispose of this. Open my sterile kit, remaining in that 1-inch border. I then will put my sterile gloves on. I then will take my catheter out and dispose of this. I'm going to check my catheter, making sure that it's not got any kinks in it or anything. I would wrap it around my dominant hand. My dominant hand is sterile while my non-dominant hand will be clean. When you pre-measure, I'm going to measure the nasopharyngeal from the nose into the earlobe. It's about 3 to 4 inches. When measuring the nasotracheal, it would be from the nose to the earlobe to the bottom of the neck, which is about 8 inches. When measuring the oropharyngeal, that's from your mouth to your earlobe, which is about 3 to 4 inches. And then your oral tracheal would be from your mouth to your earlobe to the bottom of your neck, which is about 6 inches. When measuring tracheostomies, you can't really pre-measure those, but in adults, it would be no more than 6 inches, making sure not to pass the trachea cornea. After this, I will take my non-dominant hand and I will attach my catheter here to my suction tubing, making sure not to touch inside of the catheter because it's still sterile. I then will take my sterile catheter and place it in my sterile saline. It's going to lubricate my catheter as well as just clean it. I then would take my dominant hand again, uncoiling my tube, and I will advance it into my patient, going no farther than the pre-measured. When doing this, you want to go no farther. You want to do this for 15 seconds, and when doing this, you would slowly rotate and suction as you're pulling out of the patient. You want to, after this, you would put your catheter into the sterile saline to clean it out and also to re-lubricate before reapplying. You want to suction and have breaks for 30 seconds in between suctioning. You want to make sure not to exceed a 5-minute limit. After this, you will coil your catheter back around your dominant hand, remove of your glove, and dispose of it. You also would dispose your other equipment. If you wanted to hyperoxygenate before, you would do it before, during, or after. If it's needed, you would apply oxygen after the procedure if it's needed. You also will do mouth hygiene if the patient needs it, place the patient in a comfortable and lowest position, and you would do your hand hygiene. Thank you.